Hello. Today I'm excited to share part 2 of our conversation with our new president of Research College of Nursing, Dr. Patrick Robinson. In this session, you'll hear more about how his upbringing shaped how he cares for others. I think you'll enjoy it. Take a look. So, stepping into this role, tell us, what are you most excited about?
I think what I'm most excited about is joining an organization that has such a legacy of quality and excellence. I did my homework pretty well, and everything that you hear about Research College is just superior academic quality and outstanding outcomes. And it's just very humbling to take the helm of that at a time when hopefully we will be growing our enrollment to better meet the needs of both Research Medical Center, the HCA as a whole, and certainly the Kansas City community.
Oh, it's perfect timing. In June, Research College of Nursing hosted area high school students for our Explore RCoN event.
Yeah.
So can you tell us a little bit about the summer nursing experience and why it's so popular?
Yeah, I think that is something that RCoN does uniquely. I have not seen that done at any of the other colleges that I have worked at. But what it really is trying to get high school students excited about a career of nursing. So we actually bring them here to Research Medical Center, and we do some fun, interactive sort of teaching that gets them interested in the profession. But most excitedly, they get to go with our students and our faculty and actually shadow actual nurses on the units throughout the whole HCA system here in Kansas City. So they get a first-hand look at what nursing is going to be like. So it's planting a seed, but it's planting a very robust seed because they really know what they're going to get into. And of course, our hope is that they choose Research College, and we also give them all of that information as well. And it was a lot of work, but it was a lot of fun.
I bet. That sounds amazing. And that's just a great way of how HCA and Research College of Nursing are showing up for our community and connecting with those students early on to teach them about the wonderful opportunities you can best prepare them for. If someone were to ask you what one word people would use to describe you, how would you respond to that? I think I might have asked you this during your interview too.
You know what? And I don't know what I answered then, but I think what I hope people would say is that I am fun-loving. Work is where we spend so much of our time. And I try to bring exuberance, and I try to bring happiness. And I always say that if you're not laughing at least once a day in your workplace, you're probably not working at the right place. And I gotta say, personally, I bring a little bit of irreverence to that also. I mean, what we do is serious. Nursing is serious. Healthcare is serious. So we do have to sometimes just kind of make fun of ourselves in the situations we're in to get through it.
Absolutely. So, getting to know you a little bit better, do you have any hidden talents, or maybe share something about yourself that maybe others don't know yet?
Well, my first love and what I thought I was going to end up doing was to be an actor at theater.
Okay.
So I'm trained in dance. So
Really?
I took dance lessons almost all the way, 3-4 times a week, all the way up through high school. And I can still tap dance pretty dang good. So I think that surprises a lot of people.
Yes. Oh, that's good to know.
So that doesn't come in useful that much in this job, but
I'm sure we can find a way.
If there's a talent show, I'll be there.
Perfect. Switching gears a little bit. We know you have a passion for social justice and health equity.
Yeah.
And in your first months here, we know you joined walk teams in the community for both Juneteenth and our Pride parades. Tell us where that drive comes from and maybe other groups that you're involved in or look to get involved with.
Yeah, so that starts very young. I was raised by a physician father and a nurse mother who taught me from a very early age that our lives are to be lived for others. And they were in practice together. She was my dad's office nurse, and he never charged a patient a copay. He never sent a patient to collection, and if a patient couldn't afford their medication, my mom would actually walk them to the pharmacy and buy the medication. He was a neurologist, so we're talking really about mostly epileptics who needed their seizure medication. So I learned from a very early age to equate healthcare and the provision of healthcare with being an act of social justice. When I graduated into the midst of the AIDS epidemic and dedicated so much of my early career to that. And that was at a time, well, not that it's any different now, but it was at a time especially when people with HIV were highly marginalized, highly stigmatized, and access to drugs was very much on who had the ability to pay. So that really galvanized my sense of social justice. I'm involved in a lot of organizations that promote social justice and health equity. One of the ones I'm most proud of is I am on the advisory board of Partners in Health, which is probably the country's preeminent international health capacity building group out of Boston, who does health capacity building in Africa, Central America, Haiti, and that's just a big honor for me to be a part of that group.
Well, we appreciate your passion for that and what you're bringing to the college around that topic. Thank you, Patrick, for sharing your vision, and thanks to all of you for taking your time to learn more about Research College of Nursing. If you missed the first part of the conversation with Dr. Patrick Robinson, we'll be sure and send the link so you can access that to hear the whole story about his vision for Research College of Nursing. Thank you.